This is WFYI News Now. It's October 3rd, and I'm Abriana Herron. On today's show, cleanup efforts at a historic women's prison. Elanco Animal Health celebrates the opening of its new global headquarters. Health officials discuss how to improve Indiana's infant mortality numbers. And a local mental health facility, Options Behavioral Health Hospital, is set to close. A recent investigation into that facility uncovered widespread allegations of violence, abuse, and neglect, which led to more questions.
And it kind of unraveled from there. We started with what else are patients and families saying? This seems to be a widespread problem, to, okay, now we're hearing from the employees, and now we're looking at the parent company behind Options, which is Acadia Healthcare.
Those stories coming up. But first, we reported yesterday a record number of cyclist deaths this year and concern from advocates that funding for the issue has gone away. A quick update to that story. A recent addition to the city budget did earmark $1 million for pedestrian and traffic safety. The Vision for the Prison event Saturday will invite community members beyond the fence of the historic women's prison site to take part in cleanup efforts and see plans for the property. The city of Indianapolis took control of the site of Indiana's first women's prison last year. The 15-acre historic site has sat fenced off and mostly neglected since 2017. Local community organizations partnered for the event. Joey Newsom has been active in local efforts for years and says the site transfer to city control has resulted in new progress.
The site was horrendous. There was, trash everywhere, overgrowth on the sides of the prison. People were breaking in. It was horrible, and we would call the state, and every once in a while we get a response.
After the cleanup, the area will open for a variety of activities, including interactive tours, pop-up shops, music, and a presentation of redevelopment plans. The historic prison site will be open Saturday from 9 to 3. A long-awaited project in the overhaul of the old GM stamping plant site near downtown Indianapolis is complete. Jill Sheridan has more about how the project could be a catalyst for the health industry in Indiana.
Elanco Animal Health celebrated the opening of its new global headquarters this week. The event marks completion of the cornerstone building in a new area dubbed One Health Innovation District. Elanco President and CEO Jeff Simmons says the district will open doors in the Hoosier State.
That's going to cross human, animal, plant, and environmental health. And really, this state has the forces to do that better than anybody else. I said today, I believe One Health, we're going to be as known for that as we are for sports in the state of Indiana.
Purdue University also committed to building in the Innovation District. Elanco recently purchased the rest of the nearly 100-acre site that sits on the White River across from downtown. The company employs more than 700 people in Indiana. The $200 million project has been in the works for the past 5 years. I'm Jill Sheridan.
Indiana's infant mortality numbers fell to a historic low in 2024, but still tracks above the national average. As Ben Thorpe reports, health officials last month discussed how to continue improving those numbers.
Last year, Indiana reported 6.3 infant deaths for every 1,000 births. The national infant mortality rate is lower, at about 5.6. But Indiana's numbers represent the best rate the state has seen since officials started tracking it more than a century ago. During a State House meeting with health officials in September, lawmakers asked how the state can keep improving. State Health Commissioner Lindsay Weaver said it's crucial that state initiatives focus on the needs of individual communities.
We know that often when there is not a delivery center, we know that those are the areas we're worried about having access to prenatal care as well.
Some lawmakers raised concerns that the decision to cut public health funding to local health departments could undermine the state's progress. I'm Ben Thorpe.
And for our final story today, an investigation into a mental health facility in Lawrence has uncovered widespread allegations of violence, abuse, and neglect. Now that facility, Options Behavioral Health Hospital, is set to close. I spoke with Mirror Indy health reporter Mary Claire Malloy, whose reporting brought these issues to light. So what prompted you to start looking into Options Behavioral Health Hospital?
I heard from a law firm called Cohen and Malad, who was taking on a case of a woman from Noblesville who described being held against her will at the facility, threatened when she tried to leave, and coerced into taking naked photos. Those details are in her lawsuit. And once I sat down with her name's Paige Dufour, we had an interview. And once that published, the floodgates opened, and so many people reached out to me saying, I had the same experience at Options. And it kind of unraveled from there. We started with, what else are patients and families saying? This seems to be a widespread problem, to, okay, now we're hearing from the employees, and now we're looking at the parent company behind Options, which is Acadia Healthcare.
And so your ongoing coverage of Options has revealed troubling issues from widespread violence to serious allegations of sexual abuse. What were some of the most shocking or disturbing details you uncovered during your reporting?
I didn't go into this thinking that there would be this type of widespread abuse. It's sort of something that was uncovered when you dig in deeper. And it started with a nurse who said the facility allowed a convicted rapist to be there, and they didn't separate him from vulnerable women. And that's what she alleged to us, and that she was asked to basically cover it up by the CEO. And starting from there, then I wanted to get my hands on police reports and see, is there a pattern of widespread abuse, and how is the facility responding to it? So just uncovering those numbers was really disturbing. But I also think that I've heard from people that it was good that it was brought to light, even if it was painful. That's what a lot of patients and their families have said to me.
Options is set to close in early October. However, the parent company is planning to open a new facility on the west side of Indianapolis. What do you know about this new facility?
So I guess just to give a little background, Acadia Healthcare is a multi-billion-dollar behavioral health company that runs facilities like Options across the country. And they've been under scrutiny from the New York Times for an investigation where the Times found they were holding people against their will for insurance money. They also settled a fraud probe with the Department of Justice for $20 million recently. So Acadia, it's nothing new. It's just when you walk into Options, you don't know that that's an Acadia facility. It doesn't say Acadia on the door. A lot of patients maybe know about Acadia, but they don't know that the local facility they're walking into might have these history or these allegations against them. So there's a new facility Acadia is opening at Milestones Behavioral Health on Indy's west side. I don't have the full knowledge of when it opens, except that it will. And some of the patients and families I spoke with said, yes, we're happy Options is closing, but they're basically just moving down the street with a new name. And that they worry that the same practices and abuse will occur there because it's Acadia.
What do you hope happens because of this reporting that you've done?
I hope that there's more transparency around what happens at mental health facilities. It was sort of difficult to get information sometimes. And I also hope that, people aren't harmed. I hope that they can go to a facility and get the help they need and leave without feeling further traumatized. And I hope that the stories that we told and the voices that were featured maybe help someone else feel comfortable coming forward about what happened, or feel comfortable still seeking mental health care, which can be so stigmatized.
Thank you so much, Mary Claire.
Yeah, of course. Thank you for having me.
That's all for today's episode of WFYI News Now. Our podcast is produced by Zach Bundy with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back on Monday.